How has TB impacted humanity throughout history? Imagine a disease that has traveled with humans for tens of thousands of years, shaping societies and challenging public health efforts along the way. Tuberculosis has been a silent companion through much of human history. It is caused by the bacteria Mycobacterium tuberculosis, which is estimated to be over 70,000 years old. Evidence of TB has been found in ancient Egyptian mummies and mentioned in early texts, showing how long this disease has affected us. In medieval Europe, TB was called scrofula, or the king's evil, because it was believed that royal touch could cure it, reflecting how societies tried to respond to its threat. During the 18th and 19th centuries, TB was often called consumption because of the wasting away it caused. People with TB would become pale and thin, and the disease spread rapidly in crowded cities during the Industrial Revolution. At that time, it was one of the leading causes of death in Europe and North America, killing about 1 in 7 people in some regions. The discovery of Mycobacterium tuberculosis by Robert Koch in 1880 was a major breakthrough. It proved that TB was an infectious disease, which led to advances in diagnosis and treatment. Even with this knowledge, TB remained deadly into the 20th century. Improvements in nutrition, better living conditions, and the development of antibiotics in the mid-1900s helped reduce TB cases and deaths in wealthier countries. However, TB was never fully eradicated. In the late 1900s, the disease made a comeback, especially with the rise of drug-resistant strains and the HIV/AIDS epidemic. HIV weakens the immune system, making it easier for TB to take hold. In the 1990s, the World Health Organization declared TB a global health emergency because cases and deaths increased sharply, with millions of new infections each year. Today, TB still causes over 1.25 million deaths annually and infects millions more worldwide. Multidrug-resistant TB, or MDR-TB, is a serious challenge because it requires longer, more complex, and more expensive treatments with lower success rates. Despite these hurdles, global health efforts have made a big difference. Vaccination with the Bacillus calmette-guerin vaccine, better diagnostic tools, and effective antibiotic treatments have saved millions of lives since the year 2000. From a public health perspective, TB has driven the development of disease surveillance systems, treatment protocols, and international cooperation. Ending the TB epidemic is a key goal of the United Nations Sustainable Development Goals, which focus on prevention, early diagnosis, and addressing social factors like poverty and overcrowding that help spread the disease. In summary, TB has had a profound impact on humanity, influencing medicine, public health policies, and social attitudes for centuries. While we have made significant progress, TB still challenges us today. Continued efforts in prevention, early detection, and treatment are essential to reduce its global burden. Always remember, if you have concerns about TB or any health issue, consult a healthcare professional for personalized advice.